Hello guys, good morning. Welcome back to my channel Malik Helps. Uh, Today the video is gonna be on the topic tumor. So I have collected some 170 questions over the tumor. I'll try to explain all of them to you and some of the things which we can remember. The questions are around 170. No need to get panic. I have highlighted the main things in very well way. So if you will watch the video some 2-3 times, you are going to remember the things very well. So no need to worry about it. You can pause the video and read the question again and again carefully. No problem. I'll be in a faster way because we know that the content is a lot and we have lesser time left for KROK, some 10-15 days. So let's start without wasting any time. First thing, what is tumor? So tumor is the abnormal growth of cells that can occur in any tissue or organ in the body. So there are two types of tumors, benign tumor and malignant tumor. So benign tumors are non-cancerous. They don't spread to the other parts. They will be growing slowly, remain localized to one area. For example, lipoma, fibroma, adenoma. As you can see, the meaning of them is written over there. Malignant tumors are cancerous tumors which will malignize, and they are some sorts of the dangerous cancers. So some examples are there: carcinoma of epithelial cells, sarcoma, lipomas, and many more. The general symptoms are unexplained weight loss, which will be the key word we are going to use as a highlight or hallmark of KROK question. Fatigue, which will not improve on the rest because it is not related to any kind of angina or something else. Pain, if the tumor will press some nerve, bones, or organs. Night sweats. Night sweat is more like a part of specially Hodgkin lymphoma, but other tumors or cancers may also show night sweats. Loss of appetite. First is brain tumor. So the main thing to highlight is in the brain tumor, we are going to see neurological symptoms since it is related to the neural system. So headache, often worse in the morning, vision problems, seizures, difficulty walking. Since the problem is with the CNS, so we can consider it as a sensory problem. So difficulty walking, speech, concentrating, personality or mood changes. Next is breast tumor. So in breast tumor, sometimes the patient detects the breast tumor in herself by herself itself. So there can be changes in the size and shape of the breast. There can be skin dimpling and nipple discharge. Nipple discharge can also be another condition, but the nipple retraction, this is something we are going to use a hallmark in KROK question. That nipple retraction is for sure, we are sure about the breast tumor or cancer. Lung tumor. In lung tumor, the main thing to highlight is coughing up blood. Other symptoms are not really typical for the tumor itself, but other symptoms can be present when the tumor profile is given in the question. So coughing up blood is something hallmark for the lung tumor. Another is colorectal tumor. In colorectal tumors, we are going to see blood in the stool, abdominal pain, or the bowel movement changes, bowel habit changes. In liver tumor, same way as the liver got affected, always we see jaundice, nausea, vomiting. And these are the things. Liver. Bone tumor. In the bone tumor, we are going to see bone pain. Never misdiagnose the bone pain with multiple myeloma. Just remember that when there is multiple myeloma in the patient, so he is also going to complain about the bone pain. That the patient will explain the doctor that the pain is not really in the muscles. In the cases of multiple myeloma, the pain is in the bones. So unexplained fractures because of severe osteoporosis. Skin tumor, also known as melanoma, we are going to see some changes in the moles appearance. Moles are the black dots over our body. So the concentration of the pigment melanin. So change in the mole's appearance, any discharges from the mole, or itching, tenderness, bleeding in a mole. The main symptom about malignant tumor to remember. So this is the cancer spreading to the other parts, which will arise in some primary site and we'll find it in the secondary site. Most of the time tumors got malignant to the lungs itself, like clots. persistent symptoms, often worse with the time as a cancerous process, lymph node enlargement, swelling, especially in the neck, groin, and underarms. So this is what we are going to discuss. The mains: pheochromocytoma, pancreas tumors, kidney, thyroid, uterine, cryoepithelioma. Acute and chronic leukemia is itself a high ill topic, so I'll try to make a separate video over this topic if I get enough time. So a pituitary tumor, pubertal dyspituitarism, which is a pituitary insufficiency, fibroadenoma, hysterocarcinoma, lung cancer. We are going to see all of them. I have highlighted the colors because same colors I have used in the question as well. If you want to remember something with the colors, you can go for it, because I myself have remembered the things with the colors. So let's go to the first patient. The first patient states that a 30-year-old male noted the growing fingers and facial skull changes, complains of poor eyesight, x-ray shows broadening of sella turcica. So this is something we know that nothing else in the option will be there. So there was only one option related to either pituitary or hypophysis is nearby to the pituitary. So we are going to mark adenoma of hypophysis. There are also the signs of increased intracranial pressure. If you don't know what are the signs, watch my first video. I have explained very well that the increased intracranial pressure signs are just opposite to the signs of shock. Next patient complains of retracted nipple. This is what we wanted to hear from the examiner. So retracted nipple, we know that always to mark cancer of the mammary gland. So another things are given, like the total profile of the tumor, like the pain in the breast, the condition worsens before menstruation, edema of the right breast, hyperemia, unclear painful infiltrations in the lower quadrant. So main thing, we got our keyword retracted nipple. This is which can be caused by only cancer or tumor. So mark cancer of mammary gland. Next is the examiner says that the changes in the uterus looks like cauliflower. So cauliflower is the cauliflower is something destructive shape of the uterus. So it marks the destruction. If you want, you can remember the signs as well, but these signs are specially for the cancer signs of uterus. But cauliflower itself is enough to know about that there is some destructive changes. And when the question doesn't make enough sense to you, then go with the cancer option instead of other pathologies. So cauliflower destruction of the uterus mark the cancer of the cervix of the uterus. Cervix is rounded in shape. Normally it should be oval or rounded, as we have seen in the clinica. But cauliflower shape, as you know, or the cauliflower shape, so it's destructive shape. Another patient complains about the weakness during 2 months, pain in the right side of the thorax, cough, blood in the sputum. So not a lot of pathologies are there when there is severe blood in the sputum. So also it says a triangular shadow is connected to the mediastinum and the lower lobes. So blood-streaked sputum plus some opacity on the X-ray, which is triangular, is highlight for the cancer. Next, let's go another cauliflower patient. The uterus looks like cauliflower, so mark cancer of the uterus. Next is this is something which my friend has marked wrong. So a 25-year-old stomach ulcer had a course of treatment. 2 weeks after 2 weeks developed constant pain, increasing and resistant to the medication. He got resistant to the medication. Abdomen is painful in the epigastric area, moderate defense in the pyloroduodenal area. So they are not asking about the pathology this time. What is the pathology? What is the cause of pathology? They highlighted the word stomach ulcer. We know that the main complication is not the bleeding. The main complication is malignization. So we go with the malignization. I told you that my friends are marking this question as wrong. So don't mark it wrong. Remember that the complication of stomach ulcer, the final thing will be malignization, the most severe. Next patient says that he got problem with the swallowing of the solid food. So if it is achalasia, then the problem should be with the solid and liquid foods both, right? So he lost 6 kg as well, as the question highlights. So 10 year ago had a case of MI. We don't care about that. We got what we needed for our question to mark the cancer of the esophagus, because he got the problem in the swallowing with the solid foods. So if do not mug up with the achalasia. When the problem is with the solid and liquid food, we go with the option achalasia. So since here the problem is with the only solid food, so mark the cancer of esophagus. Next is thyroid gland. So for the person who lived in a hot area after an accident with the nuclear object, greatest risk within the first decade is represented by the cancer of what? So it should be the thyroid gland. We can remember it with the Chernobyl incident of the Ukraine. So when there were nuclear destruction or the radiation in the air, so they got problem with the thyroid gland. So we can remember that thyroid gland is sensitive to the radiation exposure. Next is pheochromocytoma. This is the question highlighting something else. There is medullary thyroid gland cancer and pheochromocytoma. So the examiner asks about which operation you will do first. There are both type of the cancer. So which operation you need to do the first. So I'll tell you about the profile of pheochromocytoma in the uploading questions. But just remember that in pheochromocytoma, the blood pressure is severely high. Like it will go up to 200, 220, 240 like that. So we need to go for the operation of pheochromocytoma first of all, which is the tumor of adrenal gland. So I'll tell you more about it later. Just remember that first we should do the operation of pheochromocytoma so that the patient may feel stable finally, because his BP will be low. BP will be okay, I mean, in the normal ranges. Next is a 28-year-old woman reports about the some enlargement in the size of the pigment nevus. The pigment, when start to discharge, we see in the introduction portion that when there are some problem with the pigments start to release discharge or painful, it is also wetting or itching. So the test which we should do is we will go with the incision biopsy directly. I'll tell you the difference between incision and excision biopsy in some upcoming question as well. Just remember that in incision biopsy, we are just going to incise, make a cut, and then take the biopsy from there. So I'll explain you in the written way in next portions. Next is a patient with the benign prostate hyperplasia. So he was having after alcohol, he got some acute urinary retention, and so for releasing the urine, they use some metallic catheter. But even after they use the metallic catheter, the right epididymis got enlarged, thick, painful, and there are purulent discharges from the urethra. So they are asking about the emergency care. So since there are purulent discharges from urethra, so the metallic catheter or any kind of catheter is not going to solve the problem. So what to do with the emergency care? We are going to mark trocar. So trocar, or we call it open episiotomy also. So what happens in the trocar is is a arrow type sharp device which we use for the drainage of the pus from the bladder. So just to remember, when you see the emergency care, when it is asking about emergency care for when there are the patient is having purulent discharges, remember to mark trocar or open episiotomy. So next patient says, 45-year-old patient, he is having some right subcostal itching pain in and dark yellow color of urine, some significant weight loss for 1 month. We know that the problem already from the question, we know that the right subcostal pain is either related to the something gallbladder or something pancreas, but the examiner states about the curvature sign. So a curvature sign means the enlarged gallbladder. So enlarged gallbladder, why the gallbladder is enlarged? So when the head of the pancreas is having cancerous, since we know that the cancer is the abnormal growth of the cells, so it will cause some sort of congestion in the area. So we know that the bile duct is connected, bile duct will go towards the pancreatic head. So when the bile duct is going toward the pancreatic head, but the bile cannot flow anymore because the head of the pancreas is so enlarged due to the cancer. So when they say curvature sign, mark the head cancer of the pancreatic head. So due to the enlargement of the pancreatic head, the bile will not be able to flow anymore, due to which the patient have this and this symptoms. Here is some things written: jaundice plus dark urine, nothing important. Let's go next. Blood in urine. So there are a lot of not a lot of pathologies in which there is severe hematuria. As if I remember, is it can be cancer, it can be a good pasture syndrome, or some one two more which I don't remember right now. So blood in urine, no pain, kidneys are not palpable, external genital have no pathology. So if the external genital have no pathology, there is no changes in the cystoscopy, and the suprapubic region has no peculiarities. So what's the problem? Problem is cancer. When you cannot make enough sense of the question, go with the answer cancer. Blood in urine and nothing else is problematic, no pain. So when the question doesn't make enough sense, like nothing at all, so mark the cancer. Next is pheochromocytoma. As I have told you, in pheochromocytoma, the BP can go to severely high. That's why we did the emergency treatment last time for the pheochromocytoma. So this is a female stating this much of the pressure, the arterial pressure. Pheochromocytoma, the doctor already suspect. So what mechanism of hypertensive attack does the patient have? So this hypertensive attack is as a result of catecholamine concentrations. As I have mentioned in my first videos, which hormones are released by which portion of the adrenal gland, the cortex or the medulla, you can watch it. The mechanism of hypertensive attack is given by the increased concentration of catecholamine. When there is pheochromocytoma, the tumor of the adrenal gland, the cells multiply like uncontrollably due to the pheochromocytoma, adrenal gland tumor. The cells multiply uncontrollable manner, and which will lead to the a lot of release in the catecholamine even with the slight exertion. So she have acute attacks of headache due to this much of pressure. Let's go next. Next is the profile of lung cancer. So we all know that any problem with the lung, we got dyspnea, breast pain, weakness. Vocal tremor over the right lung cannot be determined. Percussion sound is dull. Breathing cannot be auscultated. Blood mixed with mucus. So we see in the introduction part that most of the time when the blood is in the sputum, when there is too much blood, diffusively, the question screams diffusively. So when it says that there is too much blood in the sputum, so mark cancer of the lungs. Next question says about the 32-year-old woman have menses within abundant, long menses with the 3 months. The body of the uterus is enlarged, and according to about 12 weeks of pregnancy, distorted, dense consistence. Appendages are not palpable. Adenocytes, hyperplasia of endometrium. This is the main thing we must know in the question, that hyperplasia of endometrium. So some abnormal growth of cell is there in the endometrium layer inside the uterus. So what tactics we will do? We know that this can be solved by always by the surgical treatment. In some another question, they will prescribe the hormone therapy also after the surgical treatment for quick recovery. I'll let you know in upcoming questions. Next is benign prostate gland carcinoma. So benign prostate gland carcinoma, the elderly patient states that he have problem with the urination since the prostate gland is enlarged, development of fever and chills, hypotension, sinus tachycardia, warm and dry skin, and in the blood they see absolute granulocytopenia, hemodynamic changes caused by. So the question asked that the patient only had benign prostate carcinoma. What problem has occurred that this much hemodynamical changes we notice in the blood. So let's see the answer is endotoxemia with the activation of complement system. So let's see how the complement system works. What happens is the bacteria releases toxins, the endotoxins. Endotoxin are the sort of toxins which will go to the blood. So bacteria releases toxin, they will lead to the activation of the complement system, which will lead to the activation of C3a and C5a factors, which will cause vasodilation. Vasodilation will be this much that the BP will get low, and this much low that at the end the patient will have shock. So we know now why there is a hypotension. So due to this we have hypotension, and in order to compensate the hypotension, the heart is trying to beat faster, so it shows sinus tachycardia. So those hemodynamical changes were caused by endotoxemia, which will go to the blood with the activation of the complement system. In some corner I have wrote for myself, platelet numbers are 150 to 450 into 10 raised to power 9 per liter, something normal. Sodium levels are 135 to 145 milli equivalent per liter, and potassium levels are somewhere around 3.5 something to 5.9 around something. I'll let you know in another corners. Next is I've told you about the inverted nipple. So the examiner asked about what changes the woman has changes of mammary gland symptoms the examiner asked about the symptoms so that we can mark malignization. So skin induration, skin changes, plus inverted nipple. Inverted nipple cannot be caused by any another thing, abscess or acute infiltrative mastitis, lactational mastitis, no matter what. But inverted nipple cannot be, I don't think it can be even caused by a trauma. Like why the nipple would invert even with any trauma. So only cancer can do this. Next is laparoscopy was performed to a 54-year-old woman on account of big inflammation in the pelvis that turned out to be one-sided ovarian tumor along with the omental metastasis. So what should be the tactics? So we see one-sided ovarian tumor along with the omental metastasis. So we gotta remove both of them. We are going to remove both of them, the ovarian tumor as well and omental metastasis as well. Like why do we keep them? We will the main tactics will be to remove the abnormalities. So ablation means removal, ablation of the omentum, uterus and both the ovaries with tubes. Why the uterus and both the ovaries with tubes? Because of the metastasis. The jet, you understand what urine jet is: frequent, obstructed, painful urination. So rectal examination shows that the prostate is enlarged. So when we see that the prostate is enlarged, either it can be the fibroadenoma, either it can be the or it can be the prostate cancer. So let's see. When the question says asymmetrical, so the just to remember in a shorter way, fibroadenoma will be always symmetrical. The gland enlargement, or let's say the hyperplasia, the gland enlargement will occur in the symmetrical manner, like the left lobe as well as the right lobe will symmetrically get enlarged. But asymmetric means what? The cancers are asymmetric. So the right lobe is dense, painless also is something we know that cancers are mostly painless. So I think the question makes sense now. Asymmetrical will be the cancer of prostate, and the patient is having problem with the urination. So the prostate gland is making the obstruction in the urine flow. Next. This is something to remember, or probably we know about it. Elderly people develop tumor more frequently. One of the main causes decreased activity of the cellular immunity. In the elderly people, they have age involution, and their cellular immunity, their immunity gets start to get weak. So they are more prone to the tumors. Next is the thing which we were looking for last time, that a woman underwent surgical treatment. So, serous epithelial tumor of the ovary, the postoperative period has elapsed without complication. What is necessary to prescribe for the rehabilitation period? So, they have removed the tumor of the ovary successfully. So, now for the quick recovery, we are going to prescribe the hormonotherapy and proteolytic enzyme. Let's see how do we prescribe this. So proteolytic enzymes are trypsin. Let's say trypsin is better for the wound healing. Hormonotherapy is after surgery of the ovary to balance the hormone or to prevent reoccurrence. So this is why we prescribe for the betterment of the patient the proteolytic enzyme and the hormone therapy for the better wound healing, and to prevent the reoccurrence we provide the hormone therapy. So this is now we have this excision and incision biopsy. Excision biopsy simply means removing the tumor of the mass. Incision means making a cut or opening in the body. So let's see the question. So some 40-year-old patient, she self-detected a breast mass. So no matter if it is cancerous, no matter if it is non-cancerous, if we are going to do the excision biopsy, so excision biopsy means making an incision and taking the whole mass out. So instead of just taking the biopsy, we are taking the mass out itself. Maybe through the mass we can take the biopsy and maybe confirm the diagnosis of cancer as well. But let's say excision biopsy in the breast cancer cases is the most powerful, because it is not just the biopsy, it is the removal of the whole tumor or mass. Here is written form. So this question doesn't make sense to me. Maybe if you know something, you can tell me in the comments. A rounded, well-defined shadow was found in the costovertebral angle on the chest röntgengram of an otherwise healthy 9-year-old girl. So the 9-year-old girl was healthy. Her chest X-ray shows some costovertebral angle, some shadow. So probably the shadow is related to the ganglioneuroma, the cancer of the ganglion. So let's go next. Another question over the cancer of the head of the pancreas. So the CT scan, look at the CT scan findings, the enlargement of the head of pancreas with no filling defects in liver. And on the physical exam, the head of the pancreas is hard or right upper quadrant mass that moves during respiration. So there is some abnormal mass which is moving. Weight loss they have given, so mark the carcinoma of the pancreas. Although the CT findings are really better to understand the carcinoma of the pancreas of the head, plus weight loss is there. So there is a 62-year-old smoker who often suffers from pneumonia. So he is prone to infection very well. Shows a triangular shadow. This triangular shadow we have seen previously in some question as well. So also showed deviation of the heart and mediastinum towards the lesion. So we know that in a smoker with the pneumonia who is prone to infection, shows a triangular shadow. Triangular shadow is more related to the lung cancer. Although not a lot of things are given in the question to mark cancer, but let's say there is nothing else you can mark in the question. So when the question doesn't make enough sense, mark cancer. So there is a female who is having hematuria. She have fever. ESR, I wanted to highlight the ESR, that ESR is the result, elevated ESR is the result of either infection or malignancy, but most of the time we are most of the time sure that it's malignancy. So if the antibacterial therapy is unaffected, so it's cancer simply. Here is our finding that hematuria, blood in urine. So when the question doesn't make enough sense, hematuria is most probably the cancer. There is nothing given in the question about the Goodpasture syndrome, in which there is macrohematuria as well, and there is nothing given in the question about the glomerulonephritis like nephritic or nephrotic, so nothing about that. Next question is incorrect. So the woman got breast cancer. Here is the TNM staging of that, T2N2MO. So it's just second A grade. So actually three of them therapies were not required, but I'll not tell you the correct answer here because you will maybe mark incorrect in the exam. So I'll tell you it incorrect way only, that when you see T2N2M2, like the patient having cancer, so the KROK treatment will be give all the necessary therapies like the radiation therapy, give the operation as well, and give the chemotherapy as well, although they were not necessary. It could be just simply operated or given the radiation therapy or chemotherapy, any of them. So the main thing is here the question is incorrect. When you see T and M staging, mark all of the treatment or the longest answer in the KROK option. Next is the question itself says that there is a neoplasm 2.5 centimeter in the diameter in the upper quadrant, tumor in her left breast, so regional lymph nodes are not enlarged, painless on palpation. So the question itself says the neoplasm, mark cancer. Next is elderly patient says about the prostate volume. Prostate volume is 45 centimeter cube. Which supplemental examination method will allow to determine the stage of neoplastic process in the patient? So prostate volume, I'll tell you in some questions, in the next questions, how much it should be, or prostate specific antigen, how much it should be. But just remember that if we want to know the stage of the neoplastic process, so CT is the best. So CT will visualize the best structure of the abnormal cells, so that we come to know about the stage of the neoplastic process. Next is chorioepitheloma. So chorioepitheloma is simply the group of tumor which arise from the tropoblastic tissue, which normally forms the outer layer of the cell in the placenta during the pregnancy. So let's see the changes in the patient. It's a 26-year-old woman having bloody discharge from genitals from 14 years, underwent induced abortion in 5 to 7 weeks of gestation. Objectively pale, inert, uterus was enlarged up to 8 to 9 weeks of gestation. Urine test is I'll say the hallmark finding here, because when we'll see a chorionic gonadotropin in the urine findings, and which gives a positive result here, so mark the chorioepitheloma, which is also known as choriocarcinoma. Next is Ewing sarcoma and osteosarcoma. Let's first talk about Ewing sarcoma. So something to remember is Ewing sarcoma is highly malignant bone tumor which occur in children. 10 to 20-year-old children are more prone to this. So according to KROK, when you are marking about Ewing sarcoma and osteosarcoma, the main key point to remember is we know that onion-like laminar and many more findings will be there, but the main thing to remember is the most common site of the affection in both of the cases will be the femur. When the epiphysis of the femur is affected, then mark Ewing sarcoma, and when the metaphysis of the femur is affected, then mark osteosarcoma. So let's see the profile of the patient. Is a 11-year-old child, pain in the right femur. So X-ray findings are widened medullary cavity, small foci of cancellous cells, bone destruction, onion-like laminar. So onion-like laminar, I have made an onion also here so that you remember about the Ewing sarcoma. About the osteogenic sarcoma, again it's the femoral bone. Again children under stress, at rest, denies any trauma. There was no trauma happened when he was playing in the garden or somewhere. There was no trauma detected. X-ray shows metaphyseal destruction, so destruction shown in the metaphysis. So just for you remember, osteogenic sarcoma. So Ewing sarcoma is related to the epiphysis region of the femur, and osteosarcoma is related to the metaphysis region of the femur bone. So they are not the correct findings or the exact findings. They are the most common site where these both two cancers are affecting. Next is the patient got uterine fibromyoma. So uterine fibromyoma or uterine fibroids or leiomyoma. Oh, so they are the benign tumors. benign tumors of the uterus. So this patient is complaining about the uterine fibromyoma. So the symptoms, if you want to know the symptoms, we will see in the cases of uterine fibroids or leiomyoma, it is basically non-cancerous growth of that developed from the uterus. Symptoms, we can see heavy menstrual bleeding, pelvic pain, pressure, urination, frequent urination, constipation, lower back pain, pain during the sexual intercourse. This is also a fine highlighting, because most of the time the pain during the sexual intercourse occurs in some sort of infections, but we know now that in the leiomyoma, myoma or uterine fibroids, they all are the same name of the same pathology. So there will be a pain during sexual intercourse. Enlarged abdomen is also a finding of uterine fibroids. So we know the surgical treatment should be done for in my first video of the channel, I have given the photo in that video about the uterine fibroids, so that you can see how do they look like. Let's go next. Myelograms. So this is a case related to chronic lymphoid leukemia. I'll make a separate video over the cases of leukemia, but let's see. 62-year-old patient, enlargement of cervical, subclavicular, axillary lymph nodes, subfebrile temperature for 3 months, WBCs are severely high. So this is something cancer itself. We are sure here that this is the cancer. Leukemia is what leukemia is simply, it's the cancer of the white blood cells. And what cancer is? Cancer is simply the abnormal growth. So we see the abnormal growth here. Yeah. So method of diagnosis. So method of diagnosis is myelogram. Myelogram is basically the bone marrow aspiration, that when we suspect the cancer or the severity of the blood cells of the patient is too much, so in those cases we try to take the biopsy from the myelogram so that it can be confirmed. By the way, I'll make another video over it. Next patient complains about the bloody red discharge. Menopause already occurred 12 years ago, so the bloody discharges are not really typical. She had already her menopause. So uterine cervix was unchanged, scant bloody discharges from the uterine cervix, uterus was normal size, uterine appendages were not palpable. So parametria were free because of the uterine carcinoma, of course. So when there are bloody red discharges and the question doesn't really say about any another infection, there is no CBC changes, there is nothing else to detect anything else in the question. So basically uterus was of normal size, uterine appendages were not palpable, parametria were free. Parametria got free and detached from the another area, so a mark a uterine carcinoma. So it's the same way. When the question doesn't make enough sense, go with the carcinoma. So next is the profile of thyroid gland cancer. So we see a 39-year-old patient got the tumor on the anterior surface of the neck, observed for 2 years, non-mobile. So cancer is non-mobile and tumors can move sometimes. Most probably cancers are non-mobile. It's the irregular hard mass which will affect the patient asymmetrically, like it will be on the one side. For example, in the cases of prostate cancer also we see the asymmetrical abnormal mass. So enlarge, change tone of the voice because something got stuck in his neck. Objectively, in the left lobe of the thyroid gland, there is a 3 centimeter node which is palpable, very dense. This is the profile of cancer. Loose will be the profile of maybe tumor, but cancers are dense in nature. They are the concentrated dense mass in the asymmetrical type. Tuberous, painless cancers are painless. Most probably if there is some another pathology like tumor or something, they will be painful. Cervical lymph nodes are enlarged. Functional status of thyroid gland is unchanged. Functional status of the thyroid gland is unchanged because there is even more cells grown. due to the abnormal growth, more cells has been grown in the thyroid gland, so the function is even improved. In the cancer, we will see high levels of thyroid glands, because there are more abnormal cells of the thyroid gland, which will be functioning very well, like even the function will even improve. So next is endometriosis case. So the patient is 42-year-old, having heavy menstrual bleeding. We call it this in hyperpolymenorrhea in medical terms, and progressing blah 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 blah. Gynecological examination: no changes in the uterine cervix. No changes in the uterine cervix. Chocolate color discharge. Why chocolate color discharge? Chocolate color discharge means there are some kind of RBC as well. There are some kind of abnormal cells as well. So that's why chocolate color discharge. I have made a chocolate also here. So it is brown. It is composed of dead cells and some necrotic cells. So uterus is slightly enlarged because of the abnormal growth of the cells. Appendages are not palpable. Fornices are deep and painless. So uterine endometriosis. Also, one more thing to remember here is the endometrial cancer is something which will affect or show the symptoms to the patient more in a more improved way during the menstruation time. So when the patient is having menstruation, we will see like premenstrual bleeding and menstrual bleeding, heavy menses, and it can occur even after the menopause, since the patient is in the age of having active menstrual cycle. We always see that even after menopause, this uterine endometriosis can occur. The case of chorioepitheloma we have seen. Here it is defined that group of tumors arise from the tropoblastic tissue, which normally forms a outer layer of the cells in the placenta during pregnancy. So bloody discharge, I think it's the same question which we have done. The main thing is to remember about the urine test finding. Chorionic gonadotropin gave apparently positive result. So let's go next. Next is the patient complains, 72-year-old patient complains bleeding during defecation. Tumor of the anal canal. After verification of the diagnosis, squamous cell carcinoma, the secondary metastatic tumor will be found in. So since there are two findings here, one is squamous cell carcinoma. Squamous cell carcinoma is more common in lungs as well, and also the tumor which is in the anal canal through the venous drainage will flow through the inferior vena cava, since inferior vena cava drains the blood from the lower part of the body back to the heart, and then from the heart the metastatic cell will travel to the lungs, and we will find it like clots. We will find it in the lungs. So next is some young patient. Pain in the area of knee joint, soft tissues of thigh in the affected region are infiltrated. Joint function is limited. Destruction focus with the periosteum detachment and Codman's triangle found at the defect border in the bone cortex. So reveals multiple small focal metastasis. So this is also the profile of osteogenic sarcoma. As you can see, it is a young patient, and they highlight the things easy to mark for the but the main thing to remember is when there is metastasis, we are left with no treatment anymore. So they are destructive tumors. The metastasis once has occurred, the patient life is in the threat. So provide the palliative chemotherapy to the patient. Next question about the pheochromocytoma. As you can see, the BP is severely high, which I have told in the previous questions as well. So the patient will have headache, dizziness due to the severe blood pressure, palpitation, tremor, and what more, severe frequent skin is covered with the clammy sweat. This is also a important finding for the pheochromocytoma, that the person feels like a clammy sweat. A person will keeps on sweating because the blood pressure is very severely high. Tremor of extremities. So we got enough things to mark pheochromocytoma. Next is Pain in lower abdomen. Next patient, symptoms of peritoneal irritation. So you can read the question by pausing the video. I got my point, peritoneal irritation. So if the symptoms of peritoneal irritation are positive, go with the urgent surgery because there is no another treatment. Laparotomy, we will open up the abdomen and check how much area is affected and correct the things according to the condition, according to the situation. Next is esophageal carcinoma case. So the patient feel retrosternal pain, difficulty in swallowing, 10 kg weight loss. So we see that the weight loss is typical for the cancer, but let's see what else is in the question. Anemia, leukocytosis, weakly positive, this reaction says GI bleed, or this positive reaction means GI bleed or malignancy. And filling defect. So filling defect with the ill-defined edges. So if there is a filling defect in the esophagus, so for example, if I drink milk and in my esophagus, and you are watching it with the x-ray, you took x-ray when I am drinking the milk, if there is any filling defect, the milk did not got filled in some part of the esophagus. Esophagus is a round cylindrical tube. So if the milk which I drink while you took the x-ray, the milk flowing through my esophagus to the stomach, there is some defect, filling defect, in which the milk cannot be seen, and some opacity, different kind of opacity is there. So we are sure here that there is some tumor in the esophagus which is not letting the milk to fill in that particular area. So I hope you understand what I tried to say. Esophageal carcinoma. Next is this mammary gland fibroadenoma. This nanometer. So what we have to do with the fibroadenoma? Surgical removal in prior to pregnancy. We see that in KROK question most of the time they try to terminate the pregnancy most of the time, but having a fibroadenoma is a very small thing. A mammary gland cancer, it's a very small mass. It's not even invasive. We don't even have to give the general anesthesia to the patient. We will give the local anesthesia and remove the tumor. Prior to the pregnancy itself, there will be no severe blood loss, or the patient have no chances or no risk factor related to the bleeding complication, or it's not the invasive procedure. It will not even take an hour to complete this surgery. It will be some minutes process. So it's fine to remove the tumor surgically prior to the pregnancy. Again, pheochromocytoma, you can read the question, but emergency care, remember the medication which has to be provided is phentolamine. So I don't know if it is the choice of treatment nowadays as well, but according to the KROK's treatment, remember pheochromocytoma, PP, so emergency care will be phentolamine. Next, nephroblastoma. If you have watched my first video, I have talked about nephroblastoma and Krukenberg tumor, but let's just highlight them one more time. So they are the malignant kidney tumors, and the patient says 8-month baby. They occur in children. So Wilms tumor is more common for the children under 5-year-old age. Decrease in appetite, pale skin, enlarged right side of the abdomen. Palpation of abdomen revealed dense elastic tumor-like formation. Formation is this centimeter. Positive bloodment sign. This is something hallmark. A positive bloodment sign is something like a hallmark to diagnose for the nephroblastoma or Wilms. Next is Krukenberg tumor. So there is a young female having itching pain in the lower abdomen. Normal menses cycle history. At the age of 40, she got surgery for her gastric ulcer. I wrote malignancy over there. So Krukenberg tumor, let's define it. So they are metastatic ovary tumor which will arise from the stomach. So as we can see, the patient got surgically treated for the gastric ulcer before, which got malignized this time. So another findings, both sides of palpation of the uterus reveals right tumor with uneven surface. So the question has given enough things to mark Krukenberg tumor: surgery for the gastric ulcer, and then the problem with the uterus. So the definition makes it clear now that it's a metastatic ovary tumor, arise from stomach and go and metastasize in the ovary. For better understanding, I have collected them, both of them together. So when you see positive ballotment sign in the question, because there are only one question for both of these topic each. So when you see a positive ballotment sign, mark nephroblastoma. It is a kidney tumor, malignant tumor, occur in children. Wilms tumor also known as. So a Krukenberg tumor, metastatic ovary tumor, which will arise primarily from the stomach. Let's go next. So here I'll tell you about the prostate hyperplasia. So we know that inability to urinate, this is something we know already. So the prostate, if you want, you can read the question by pausing the video. So prostate volume is 120 centimeter cube, and prostate specific antigen rate is 5 nanogram per milliliter. So let's see now, when prostate specific antigen is less than 10 ng per milliliter, this is the findings for sure for the benign prostate hyperplasia. When the prostate specific antigen is more than 10 ng per ml, this is something cancer. So now it will be easy to mark the question. The prostate specific antigen rate is given 5 ng per ml. So 5 ng per ml is less than 10. So we will mark benign prostate hyperplasia. Here is something written: benign prostate hyperplasia is symmetrical, as I have told you. Should be symmetrical because it's the problem with the gland, not the cancer. So it will be symmetrical, dense but not really very concentrated, or let's say not like this way, or let's say dense but in both side equally, not like cancer, like one lobe or one sided it's dense. So dense, symmetrical. Prostate specific antigen is less than 10, for which is 5 ng per ml given in the question. Hyperplasia we all know, increase in the number of cells. Also we call it abnormal growth. Next is ESR. For men, ESR is less than 15 is okay. For women, ESR is less than 20 is okay. For child, less than 10 is okay. And for child pro max, it should be some 3 mm per hour. Next is pancreatic head cancer. We have seen those questions already. Let's see what's main in this question. So symptoms of peritoneal irritation are present. On palpation, the dramatically enlarged tense gallbladder. Why the gallbladder is dramatically enlarged? Dramatically enlarged means very severely enlarged. So it's something destructive. The head of the cancer got enlarged, and there is no more bile flow through the gallbladder to the head parts. So the bile got stuck to the bile duct, and now the gallbladder is producing more bile. So the gallbladder keeps on enlarging because there is no release of the bile, and this is also known as Courvoisier's sign. It will be directly given in some questions. However, this question says the gallbladder is dramatically enlarged. So the same way, Courvoisier's sign. So they are both the same things: obstruction in the bile duct, painless. So cancer. Next is a patient says in the CBC of the patient, prolactin levels are 2 times higher than the norms. So a bulky formation with a diameter of 4 and 4 mm in the region of sella. So if the protein levels are 2x, some of us can mark hyperprolactinemia. So no need to mug up it with the hyperprolactinemia. We will find a lot of things in the CBC or related to other parts of the body in the hyperprolactinemia. But the main thing here is to remember that bulky formation with a diameter of 4 and 4 mm in the region of sella. So sella turcica is some another name for pituitary. So if we see some bulky formation with this and this diameter, 4 mm is enough to mark the pituitary tumor. Next is Hodgkin lymphoma. Let's see what is it. Hodgkin lymphoma is lymphogranulomatosis, we also call it. So night sweat, unexplained weight loss, fever, these all are the symptoms of Hodgkin lymphoma. It is enlarged, it's a cancer, enlarged painless lymph nodes, neck and inguinal region, dense, elastic, non-mobile. So main thing to remember here is night sweats. Night sweats is, I have told you in the introduction part as well, the night sweat is something which is very typical for the Hodgkin lymphoma. Let's see some question over it. So biopsy revealed a giant Reed-Sternberg cells. So also remember for Hodgkin lymphoma, when the question says Reed-Sternberg cells, this is a hallmark finding for the Hodgkin lymphoma. And many more things are given in the question, but when you see Reed-Sternberg cells, so just mark Hodgkin lymphoma and move on. Blood stick sputum, we all know that it's the cancer of the lungs. Blood sputum, you can read the question. Bladder tumor, so this is something which we have to remember. A 66-year-old female having a hematuria with the shapeless blood clots, frequent urination, moderate weight loss within 3 to 4 months, gross hematuria not accompanied by pain, dysuria. So we know that the hematuria is not painful. If there should be if there will be some infection or inflammation or any kind of pathology like that, so we will see pain. But now we are seeing no pain in this dysuria. First occurred for no reason, like no reason, no trauma or no sexual contact was detected, no trauma was detected. After few days bleeding subsided independently. Bleeding start or stopped, so there was nothing happened with the patient. So the main thing to remember, shapeless blood clots, where are they coming from? They are coming from the bladder. So when the patient is urinating, the shapeless blood clots are coming from the bladder. So remember that it's the bladder tumor. Next is it's something too much highlighted because we never forget to mark it incorrectly. I myself did it so many times wrong way. So let's see. The patient complains of painless, firm, mobile, dense. She detected a tumor, self-detected mobile lump, and ultrasound shows massive neoplasm, 28 into 18 millimeter. Diagnosis fibroadenoma. So mammary gland, it's a mammary gland tumor. Fibroadenoma is a mammary gland tumor which is hard, immobile, irregular. The question doesn't make enough sense to me. We can mark it wrong again, but let's remember it very well. I have highlighted it very well. So painless, firm, mobile, dense. When the question says this kind of findings, so remember to mark fibroadenoma. I have even highlighted it very well in the introduction portion where you see all those tumors with the colorful changes. So let's go next. Next is the patient complains of a right lower abdomen with the low back pain, constipation, uterus is immobile, size is of 10 weeks of pregnancy, uneven surface. We got what we needed, atypical cells. Atypical means which is something not normal, and abnormal cells are simply the cancer. Also, what we need to remember here is hysterocarcinoma, endometrial carcinoma, or uterine cancer. These all are the same names of the same cancer. So another thing to remember in this question is uterus is enlarged. Why the uterus is enlarged? Because there are atypical cells. So mark the hysterocarcinoma. Hystero word means endometrial carcinoma or uterine cancer. Let's go next. Another question over Hodgkin lymphoma. So we have to remember the name of lymphogranulomatosis because the examiner did not give Hodgkin lymphoma in the bracket this time. So night sweats, as we know already, night sweats are more typical for the Hodgkin lymphoma. Weight loss is there, unexplained weight loss in all type of cancers. So enough to mark Hodgkin lymphoma. Next is a case for the. This is it with this video. The video was getting too much longer, so I decided to make a part 2 for the tumors. So stay tuned for the second video as well.